5 signs your birth might be extra hard. Today, I'm going to talk about 5 things that I have seen as a labor and delivery nurse that have an increased chance of making your birth extra hard at delivery. I'm hoping that we can avoid some of these things or at least educate you that they might be a problem, so I'm excited that you're here. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, plus 3 kids of my own. I am here to prepare you for your confident hospital birth, and I'm excited to hopefully make birth a little bit easier for you today. I so appreciate it when you guys give these videos a thumbs up and follow me so we can hang out for the rest of your pregnancy. Okay, the first thing that has been shown in my experience to make your birth extra hard is if you don't like your doctor or you do not mesh well. Now, I 100% get that this is unavoidable in some situations. Some of you guys are rural, where you only have a couple of providers that you can choose between. Insurance gets their fingers into the game, and there's nothing you can do about that. And some of you guys are high risk, where you just have 1 or 2 doctors that you get to pick between, and you kind of get whatever you need. However, if you are before 30 weeks and you really don't like your provider and there are other options, girl, go find your other options. It can seem really intimidating to move practices, and of course the practices want to make it seem that way, but there are easy ways to change practices, and I promise you, you are not hurting your provider's feelings by finding someone else that really meshes with you better. Now, pro tip from a labor and delivery nurse, I do find that the doctors who have amazing bedside manner, a lot of times maybe are not the best doctors. So if you're one of those high-risk girlies who has a provider that they're just not messing with, sometimes those high-risk doctors they're just not great bedside, but they're great at the work that they need to be good at. So hopefully that helps you feel better if you're not in love with your provider and there's nothing you can do about it. Because I see you, I get it, do what you can. And inside the post that goes with this video, there is a whole blog post about how to break with your provider. I have so many more helpful tips in there, so be sure and check out that post. Okay, the second thing that a lot of people don't know about is previous uterine or cervical surgery. So this is your uterus, and that means that you might have had either a leap, is usually what they call it, or something where they're checking cells here at the end of your cervix. And that a lot of times can just leave a scar on your cervix. Now, usually you can still have a vaginal delivery, but I do see that a lot of times you sort of stall out until these contractions get strong enough that it can sort of break that band and baby can head into the birth canal. So if you've had a previous uterine surgery, it's just important for you to know that that can sometimes stall things 4 to 6 centimeters. And then usually baby breaks that band and then things progress normally. But I just want you to know that you might have that tricky point where things are not moving as quickly as you had hoped. Of course, if you've had a previous uterine surgery, it may be an indication that you need to have a C-section or at least something that you should talk with your provider about to make sure that you're safe in your upcoming vaginal delivery. Pro tip, that does not mean just because you've had a C-section, here's my C-section, that doesn't mean that you can't have a vaginal delivery. Then you're looking at a TOLAC or a VBAC, huge fan of those. But again, you need to talk with your provider about why you had the surgery last time and if they think that's going to be a problem moving forward and what the best option is for you. You do have a choice in making the choice about if you're going to have a TOLAC or if you're going to have a C-section next. If your provider is saying that they do not VBAC patients, that is unusual anymore, so I would get a second opinion. Number 3 is that you just aren't your best advocate. If you go into the doctor and you feel dismissed, but you really are not able to speak up for yourself, that is a sign that you are going to have some troubles during labor, because during your hospital stay, there are going to be times that you need to speak up for yourself to get the care that you need. Now, I believe this so much so that in the online prenatal class for couples, I actually have a bonus communication video where I show you how to have those conversations with your provider, because I know that it can be really difficult. I recently had my appendix out and I realized how hard it is when you're laying in the bed as a patient. It feels very childlike and they are your parent telling you what you're going to do. So when you have the words to communicate, you know what, I don't think I want my water broken yet, or you know what, I don't think I'm ready for a C-section yet. Can we wait a little bit longer so that you can start those dialogues with your provider? Now, I know a lot of people online are very adversarial, like they're like, no, my doctor shouldn't be doing anything. But I think most of you out there really want to know what your provider thinks and then balance it against your own priorities, how you're feeling, and what you want to make the choice going forward. There are very few black and white situations in medicine, and usually your provider is going to convey that if they feel like this is a very black and white situation. I recommend starting these conversations at your next prenatal appointment. If you feel like you're being brushed off, like let's say you have pelvic pain and your provider just says that's normal and they move on, but you feel like that pelvic pain is making your life miserable, that's when you're able to say, hey, that pelvic pain is actually really changing how I live my life. It is impacting my activities of daily living. That's one of the favorite things that we like to say in the medical community. So if your pelvic pain is affecting your activities of daily living, they should be looking for another person that can help them, because honestly, your OB is not your best bet for movement issues during pregnancy, but a physical therapist could be. So they should have somebody that they can recommend that you go to during your pregnancy. So start having those conversations where you advocate for yourself at your next prenatal appointment. I believe in you. And if you want help, come join me in the online prenatal class for couples, where we help you have these difficult conversations so that you can get better at it. And soon they won't even be difficult. Number 4 is if you have super high expectations for your birth. Now, I just had a viral video where I said that I love birth plans, but I do not love unrealistic expectations, because a lot of times we come in thinking, I'm going to have this golden hour and it's going to be absolutely amazing. But then our baby is born and they're not breathing so well. You don't end up having that golden hour because the nurse needs to take the baby over to the warmer, monitor their breathing, possibly give them some oxygen and do some different things. And you are devastated that you didn't get that golden hour, instead of perhaps being glad that there's a nurse there to help your baby breathe better. And yes, I see this online all the time. I know for me, I just had the expectation that things were going to be unicorns and rainbows after I had this baby, because I took a birth class at my hospital where they sort of made me feel that way. Then when things were not unicorns and rainbows after I had my baby, I had anxiety. My bottom was way more sore than I knew what to take care of. I had made my expectations for the postpartum period just way too high. So I think it's really important to have realistic expectations of how the hospital and postpartum and life with baby are going to be. One of the things I see a lot is people expect to have this overwhelming love for baby once we place baby on their chest. But a lot of people feel like, oh my gosh, so much is going on. Sometimes at that same time, your doctor's probing in your downtown, or they might be sewing things up, or just a lot is going on, or you're shaking, or you're just like so overwhelmed, you can barely even focus on that baby. So you don't feel a big old wave of baby love come over. You're just like, oh my gosh, everything's falling apart. What's going on? And that's normal. I don't think that I had that giant wave of love with every baby. I think that wave came with time. And my kids are older, some are adults, and I love them so much. Just because I didn't get that right at delivery didn't mean I was any worse parent than Stacy down the road, who said that she felt so much love for her baby the minute she saw them. To solve this, I think you really need to take advice from somebody who has seen a lot of different deliveries so that you can understand what your expectations should be. And also remember that a lot of things are just what people are saying. Who knows what an overwhelming emotion of love feels like? I think for every person that's a little bit different. And maybe I did have that because it didn't feel like I thought it was going to feel. It just felt different. So understanding what could happen during birth, understanding normal interventions like inductions, C-sections, epidurals, so that you kind of know what to expect as you go into delivery. In fact, a lot of people who take my birth class just love to skip the C-section chapter. But every once in a while, I get somebody who says, I'm so glad that I did the C-section chapter, even though I didn't want to, because when I went into the OR, I knew exactly what to expect, and it felt so much more comfortable. So just setting good expectations is so important. It's honestly so important for the rest of parenting. It's still something that Hillary works on to this day, even with kids who are 25. So expectations can be a killer. Watch them. Okay, the 5th thing is not getting prepared. So a lot of times people think their provider is going to be able to prepare them in the office, but the reality is your provider only has 15 minutes and they got to check all these different things to make sure that things are safe. They just don't have time to prepare you in addition to that. Now, you might be thinking, Hillary, I'm watching these YouTube videos. I'm totally getting prepared. And I love that you're here. I think social media is a great addition to a high-quality birth class, but I do not think that it is a replacement to a high-quality birth class. You need to get educated from the beginning, which I think means 3rd trimester, understanding 3rd trimester testing so that you can make better choices, all the way up until your first few months postpartum. So many people think that they can just cherry pick what they think is important preparing for their upcoming birth, and then ultimately find that they didn't prepare for the things that they needed for how their baby was going to be birthed. So I recommend taking a high quality birth class. I also recommend making sure that you do those prenatal appointments. I think one of the best things is once you take a high quality birth class, you can extend those things to your appointments. If your provider's like, well, I'm starting to think about some third trimester testing, you have taken a birth class, so you understand that, and you can ask them more about why they're expecting that for you or what you can expect coming up, where they do the third trimester testing. You can just go a little bit more in depth when you are prepared through a high quality birth class. And I got to say, so many people come in the labor room, and when we ask them what they want done for themselves, they just sort of blink at us because they are not prepared to make choices for themselves at all. That's why you take a good birth class. And studies have shown that a birth class can make it less likely to have a C-section, less likely to have an assisted delivery, less likely to have a larger tear, less likely to be induced because you're just more prepared to have conversations with your provider, as well as take care of yourself and communicate with your team during your delivery. Okay, those are the 5 things that I have noticed can make your delivery extra hard. Do you have other things that you think could make delivery extra hard? Tell us down in the comments. I know a lot of you might say just being induced or getting an epidural, but I got to tell you that we don't know how birth's going to happen. And sometimes those things need to happen. I know that I got induced with my last baby and I was so upset about it. I cried the entire day ahead of time. Again, unrealistic expectations. And then my delivery ended up being so quick and easy. I don't know why I cried so much ahead of time. So just getting prepared for how you're going to deliver can be a huge win. Thanks for joining me for these. If you want to join me in the online prenatal class for couples, I will put the link below. And I think you'll like some of my other videos as well.